Hey guys, so I wanted to talk about the dreaded paperwork that comes along with the diagnosis of ADHD, autism, or any type of DSM diagnosis, mental disorder diagnosis. So when you are told that your child might have autism or might have ADHD or might have depression or might have whatever, you're often asked to fill out a questionnaire. And you rank it from 0 to 10 as, highly agree, disagree, how often they do it. Do they sometimes, all the times, most of the time, those kinds of grading scales. You'll get a questionnaire. Your husband will get one. The teachers will get one if you're okay with that, or daycare workers, wherever your child is. And it's important. This is why I wanted to make this post. It is so important for you to answer those questions as accurately and as honestly as possible. It is hard. It is really hard. Some of the questions are really hard to answer. But if you can be as honest as possible, you're going to, this is for your child. You know what I mean? It doesn't make you an awful parent if your child did not walk by the age of 12 months or 18 months. It does not make you a terrible parent if you were not able to potty train your child by the age of 5. Those are questions they need to know because they're developmental. They are things that will give a better picture. If your child does not go to bed on time every night, again, a lot of parents, I feel, when they're answering those questions, they want to answer them in the most idealistic way. And you just have to be honest with yourself. And also, this is another thing. It's important that your husband or your spouse, if you're a husband and, you're talking about their wife, your spouse, if they will, each of you answer those questions separate from each other. Instead of saying, okay, what'd you answer number 3? Okay, because each perspective is important as well. Your husband might know things that you might not know, and I might know something that he doesn't know. So it's important to get the full picture. Your child may do things around you that they don't do around your husband, or vice versa. And then that'll let the clinician know, oh, maybe that's a power thing. They can get away with it, mom, but they can't get away with dad, or vice versa. Or if they're doing it for both parents, then you know that it's an obvious, thing that they need to address. So those questionnaires are a little bit hard. There's a lot of questions. And then this is another thing that I noticed. When you're filling out the questionnaire, a lot of the questions are repeated. They're repeated by design. They might be asked in a different way, worded just slightly different. But I think it's because as you answer the questions, your mind kind of goes there. And maybe you'll say, you know what? Yeah, he has done that. And then you might mark it. It's not trying to say, oh, gotcha, you were lying about that or whatever. That's not what the purpose is for. But also consistency. It's for that as well, just to make sure that there's a pattern. And see, that's the thing. When making a diagnosis for anything, there has to be a pattern, a history. If your child just does something once and then never does it again, then there's nothing wrong. You see what I'm saying? So if we're talking about patterns and habits of behavior that get worse with time and not better. If your child's a bedwetter and then eventually he stops wetting the bed, that's a good thing, right? But if your child did not wet the bed and all of a sudden they are and it's not getting better, then that's definitely a problem. Or if your child is a picky eater but eventually starts eating different kinds of food, he may have been picky, but maybe he's not picky any longer. Anyway, there's all kinds of ways that you can look at it. And I totally can relate to you. I empathize with you, and I know the pain of having to fill those things out, but do it. I promise that in the long run, you're doing what's best for your child. As always, good luck on your journey, and I'll talk to y'all soon. Bye.